Dear colleagues, many high-quality studies in the last 10-15 years have provided strong evidence that nutritional care works to prevent or treat disease-related malnutrition in all disease settings, reducing comorbidities and length of hospital stays, increasing quality of life, and ultimately survival. Despite this growing evidence and knowledge, and despite the efforts of clinical nutrition societies to promote and disseminate new knowledge, including rigorous guidelines, a large and unacceptable gap still exists between strong evidence and implementation of nutritional care in clinical practice. This is all the more inexcusable after recognition that nutritional care is a human right for every patient, inherently connected to the right to nutrition and food. In ESPEN, we have been increasingly active to fill the implementation gap, and we have promoted action to reach regulators and policymakers to increase their awareness on the huge importance of disease-related malnutrition and of nutritional care as an effective treatment. And we are very pleased now to announce today that we have prepared a document which will serve as a policy brief specifically addressing policymakers with an international approach focusing on basic, compelling concepts and data, showing the need and also the practical advantages of political action. We are also very proud that we could partner in this initiative with WHO Europe in the context of an ongoing strategic collaboration. We are convinced that the WHO high clinical and policy competence and leadership allowed at the same time for the preparation of an excellent document and to increase its potential for future dissemination and utilization. I therefore warmly invite you to check out the policy brief and to use it and disseminate in your country and healthcare system. Thank you very much for your attention.
I'm very pleased to inform that we published a policy brief on disease-related malnutrition. In this policy brief, for the first time, disease-related malnutrition is recognized as a disease. This policy brief is also very important because we get disease-related malnutrition into the public agenda, an international agenda. The policy brief is the result of a long collaboration with the WHO. In this policy brief, we describe the need to screen, to diagnose, and to take care of disease-related malnutrition. So we invite you to read and to know this policy brief.
Dear colleagues, I'm delighted that I could send this message on behalf of WHO Regional Office for Europe. I'm Kremlin Vikramasinghe, Regional Advisor, Nutrition, Physical Activity and Obesity. As you all are aware, WHO and the rest of the UN family work towards addressing all forms of malnutrition. Malnutrition can manifest in certain ways. Sometimes it's a complex issue. It includes undernutrition, which is insufficient intake, but also overnutrition, which manifests as obesity. And we have people who are living with certain diseases who are also facing malnutrition. While our region has 2/3 of the adult population living with overweight and obesity, they also lack certain micronutrients and they face nutritional deficiencies. Therefore, working together to address this issue across all the age groups and specifically with disease-related malnutrition is a priority in our region. This condition can affect individuals of all ages, as I mentioned, but particularly we want to put a focus on the elderly because it has not been addressed sufficiently in our activities so far. WHO recognized the importance of addressing it comprehensively, considering all aspects of nutrition and health to achieve better outcomes for individuals and communities worldwide. Addressing disease-related malnutrition typically involves combination of medical treatments and nutrition support. It involves healthcare professionals, dietitians, physicians, essentially to working together to develop strategies to meet the nutritional needs of the patient, to provide necessary nutrients to support the patient's recovery and overall health while managing the underlying medical conditions. Disease-led malnutrition is underdiagnosed and misdiagnosed. And also in our advocacy work, it's not given due priority regardless of the needs we have. As you know, nearly 90% of the disease burden in our region is due to NCDs, people living with cancer, diabetes, chronic respiratory disease, etc. And we have an aging population. So the need keeps growing, and there's a lot of call to action and growing base of evidence, but we have not been able to materialize into accessible, sustainable services in our systems. We are pleased to be working with colleagues from ESPEN to increase the awareness about this important topic and provide concrete action on how to strengthen nutritional care for the prevention and management of disease-related malnutrition in primary health care, in hospital outpatient, and also in patients. We look forward to working with all of you on this important topic. And I'm sure today and in the coming events, in the coming weeks and months, we will be working with you, and we are committed to make a difference in our region. Thank you.